Hello, everyone, and welcome to this webinar session on immunization for primary healthcare, framework for action, building PHC linkage within National Immunization Strategies. I'm very happy to welcome our presenters today. In the meantime, I would like to let you know that you can listen to this presentation in French. To do so, please select the globe at the bottom of the Zoom window and choose the desired language. If you struggle to find it, please let me know in the chat area. Talking about the chat box, you can already introduce yourselves and tell us where you're from and your name. You can also use the chat box if you need any technical support. I'll do my best to help you. If you have any question during the presentation, please use the Q&A box. It's available at the bottom of the Zoom window. You can ask your questions at any time. Our panelists will answer them after the presentation during the Q&A session. Finally, this session is recorded and we'll share with you the links to the video as well as the slides. I hope you'll enjoy this session, and I'll give the floor to Dr. Folake Olayinka.
Thank you very much, Alex, and a warm welcome to everyone. I'm so pleased to welcome you to today's webinar. My name is Folake Olayinka, and I'm the Immunization Technical Lead with USAID Washington. I also serve as the co-chair of the IA 2030 Strategic Priority Area 1, which is immunization programs for primary health care and universal health coverage. We're so pleased to bring this webinar to you today. And we have a really wonderful lineup of speakers, including our colleagues from Liberia and Pakistan that will be sharing firsthand experiences on building primary healthcare linkages within national immunization strategies. This webinar brings a deep focus on building primary healthcare linkages within immunization programs and immunization strategies. Reaching zero-dose children and mixed communities and life course vaccination, including with COVID-19 vaccination, will require focused efforts to leverage opportunities in primary healthcare systems and services, and mutually reinforce immunization and primary healthcare. Strengthening primary healthcare as part of overall health system strengthening efforts is essential to achieving universal health coverage and the health-related sustainable development goals. While there has been promising progress in catching up immunization in 2022 and recovering from the deleterious effect of the COVID pandemic, there were still 20.5 million children who missed out on one or more vaccines delivered through routine immunization services. Catch up and recovery and getting back on course to reach Immunization Agenda 2030 goals will require alignment and simultaneously strengthening immunization and primary healthcare. In addition, making health systems resilient and prepared to manage future pandemic threats will require substantial, quality-driven, and efficient health systems strengthening, including human resources for health. A primary healthcare approach is the most cost-effective way to achieve and sustain universal health coverage as new public health threats arise. Similarly, the Immunization Agenda 2030, a global strategy to leave no one behind, positions immunization programs for primary healthcare and universal health coverage as an overarching strategic priority. And this was signed and ratified in the World Health Assembly by member nations. Immunization is a critical component of primary healthcare and offers a clear entry point for multi-sectoral efforts to strengthen primary healthcare more broadly. Given the widely lauded strengths of immunization programs, there's an opportunity to build on these trends to benefit other programs within primary healthcare. Similarly, strong primary healthcare programs are necessary to ensure uptake of vaccines across the life course and have an important role in integrating COVID-19 vaccinations into routine systems. This is particularly apparent for vaccines administered at different ages. The 14 levers of the WHO-UNICEF primary healthcare theory of change form the basis for the framework for action for immunization and primary healthcare, linkages that we will be discussing today. It can help countries use health resources to put in place a strategic approach in which immunization efforts strengthen primary healthcare, and primary healthcare strategies promote immunization at all stages of life. Today, we will learn more about the immunization and primary healthcare framework for action and ways to build primary healthcare linkages. We will gain insights from case studies and hear about experiences from our colleagues from Liberia and Pakistan. With that, I am pleased to invite Johanna Feeman from WHO and the National Immunization Strategies Steering Committee to provide some remarks as well. At any point, please do put your comments and questions in the Q&A box at the bottom of your screen. Johanna, over to you.
Thank you so much, and welcome everyone. It's very nice to see so many names and so many participants. My name is Johanna Feeman, and I work in the immunization department at WHO headquarters, and I'm the focal point for the National Immunization Strategy. And I'll have the pleasure of introducing a bit this, providing some context to the discussion here. First, on IA 2030, and as mentioned by Folake, this is a global strategy that has been endorsed at the World Health Assembly with three main objectives: reducing by 50% the number of children receiving 0 vaccine doses, achieving 500 introductions of new or underutilized vaccines in low and middle income countries, and reaching 90% coverage for essential childhood vaccines by the end of the decade. Next slide. And I think what we really want to highlight here is the NIS, the National Immunization Strategy, is a key pillar to the implementation of IA 2030. And you can see on this graph the view of the positioning of the planning at country level that really allows countries to identify their priorities and to elevate those priorities as part of the IA 2030 structure. The NIS has been designed as a tool to support countries defining these priorities, including on new vaccine introduction, to really be able to understand the vision and the direction that countries are bringing to IA 2030. Next slide, please. So why are we encouraging countries to consider this strategic planning approach? Folake mentioned this already, but we've seen in the last months and years, of course, the cost of vaccination increasing, and especially following the COVID-19 pandemic. Countries do need to recover childhood immunization coverage to pre-pandemic level, and at the same time meet the ambitious IA 2030 objectives that I just mentioned. And all of this, of course, in a context we're all very much aware of, including the ongoing economic crisis that entails the fiscal pressure and the limited resources for many competing priorities. In this context, strategic planning is essential as it allows for the definition of objectives and priorities at a strategic level, and to allocate the resources to achieve these goals aligning with the national, regional, and global strategies. So in this context, on the next slide, and this will be my last slide, the NIS, the National Immunization Strategy guidance, was released in August 2021. We've been working for the past 2 years in close coordination with our colleagues from UNICEF to support regions and countries towards strategic planning. What you see on this slide are essentially the overall principles of the NIS, the alignment with the strategies that I mentioned, but also the importance of country ownership, building these priorities based on national dialogue, being strategic and streamlined with a costing approach that supports a budget dialogue and financing, meaning that the priorities and the plan is overall realistic because it's based on an agreed resource envelope. And for the sake of the discussion today, the importance of integration, which is very much linked to this idea of prioritization and to optimizing available resources. How can the NIS be integrated into national health sector planning and adapted to the country processes? On the right side here is the overall view of the NIS stakeholders mapping and all of the different stakeholders that may support countries in developing their strategic plans in close collaboration with the overall health sector. So really highlighting again that the NIS is focusing on immunization priorities, but in a much broader environment that really provides an opportunity to engage with the broader health sector and identifying, of course, linkages with primary healthcare to optimize the programs and the resources. And with this, I'll hand over back to Folake.
Thank you very much, Johanna. And we are thrilled to be able to have our next speaker, Tova Tampe.
Thank you very much for the excellent introduction, Folake, Johanna, and Dr. Lola. It is a pleasure to be here with you from WHO's special program on primary healthcare and to provide an overview of the IA 2030 Immunization for Primary Healthcare Framework for Action and its linkages to National Immunization Strategies. Next slide, please. Primary healthcare is central to IA 2030 and thus in the development and execution of national immunization strategies. IA 2030 recognizes the importance of strong health systems built on primary healthcare, and aligning national immunization strategies with these goals promotes the strengthening and resilience of health systems. A strong PHC-oriented health system can enhance the effectiveness and reach of immunization efforts. National immunization strategies and PHC have shared goals, as we can see here, both of improving the health and well-being of populations, and by aligning these goals, they can reinforce each other's objectives. Next slide, please. If we look here at the three main components of PHC, we can further see how they relate to immunization. And these are multi-sectoral policy and action, empowering people and communities, and integrating health services, especially primary care services, as well as population-based public health services. Next slide, please. And this slide here shows the PHC theory of change, which Folake mentioned earlier. And when applied to immunization, this helps us see how integrating immunization into a comprehensive PHC framework can lead to better health outcomes. Here we see the three components as just described on the left-hand side, reinforced by 14 levers, which translate these components into actions. And integrating immunization into the PHC framework aligns with the principles of equity, accessibility, and holistic care. This integration improves vaccine coverage, leads to timely vaccination, and supports community engagement, all of which contribute to better health outcomes and reduce disease burden. Next slide, please. Building on the PHC theory of change, the Immunization for PHC Framework for Action was developed to provide practical guidance and examples from different countries on how to apply a PHC-oriented approach to strengthen routine immunization services. This real-world experience offers beneficial insights for national immunization strategies. By adopting this framework, countries can strengthen their immunization programs, enhance healthcare delivery, and work towards the collective goal of ensuring equitable access to vaccines and better health for all. Next slide, please. The framework for action underscores the integration of immunization with a range of healthcare services. Integrating immunization services into primary care can help ensure that individuals receive a complete package of quality essential healthcare services. Immunization should also be integrated with broader PHC strategies. National immunization strategies can benefit from this approach by ensuring that vaccines are part of a holistic healthcare delivery system. This integration helps enhance healthcare services and accessibility. Next slide, please. PHC also encourages community engagement and participation, and this is essential for the success of immunization programs. Primary care facilities and workers often have strong connections with local communities, making it easier to build trust and ensure vaccine uptake. Immunization and PHC stakeholders can work together, engaging communities to help set priorities, make decisions, and employ strategies to address equity gaps. Next slide, please. Working across sectors is key to addressing the determinants of health. Immunization and PHC stakeholders can both contribute to working with finance, education, social, gender, and other ministries to ensure a holistic approach is taken to addressing population health needs, including advocating for health and all policies where possible. Next slide, please. In the next few slides, we will dig deeper into the 14 levers of the PHC operational framework and explore how immunization-related actions can be considered for each. For each of the levers, we can see examples on the right-hand side of the immunization-related actions to be considered. And I won't go through each of these, but I'd like to highlight a few. And for the strategic levers, I'd like to highlight here under the governance and policy frameworks, one action recommended is developing national immunization strategies in collaboration with PHC stakeholders. Next slide, please. Here we have the operational levers of the PHC operational framework with examples that can be applied to immunization, and I'll also highlight a few as well. The models of care lever emphasizes integration of immunizations with other health services throughout the life course. Within the PHC workforce lever, policies that attract and retain healthcare workers at the primary care level can be considered. And within the medicines and other health products lever, we can look at ensuring supply chains and supply chain management systems are in place to support the equitable distribution of vaccines and other health supplies. Next slide. And then moving further down the list of operational levers, I'll highlight a few more examples here. Looking at digital technologies for health, activities such as SMS reminder systems and the use of electronic health registries can be considered. Within systems for improving the quality of care, this looks to continuously assess and consider ways of improving quality and access to integrated immunization services. And a final example here is under primary healthcare oriented research. This lever, which points toward the promotion and use of research related to integration of immunization with other health services. Next slide, please. Next, on this slide, I'd like to share some potential linkages within the NIS development process itself. So in this slide, we see here the 7 steps of the process, and within each step, some areas that can be considered related to PHC. During the preparation step, consultations can include PHC and health systems focal points, and also consider factors in the discussion linked to PHC. For the situation analysis, in addition to NIS guidance that's already given on this, it's important to consider health system barriers, and using the framework for action can guide that analysis. In addition, as part of the resources that are used to undertake the situation analysis, one can use PHC resources as part of the desk review process to more fully understand challenges in reaching populations with both immunization and primary care services. And then within the strategy development itself, ensuring that the NIS is aligned with broader health policies in country is absolutely critical. During the monitoring and evaluation steps, ensuring that indicators also monitor PHC aspects is important. And some examples that have been used in recent NIS, including Liberia, which you'll hear more about in a little bit, include monitoring the percent of districts that review immunization performance as part of primary healthcare performance at least annually, and looking at the percent of PHC centers integrating immunization services with other primary care services. Looking at the resource estimates should also consider PHC-related interventions, and the budget dialogue for the NIS should align to national health policies and strategies. Lastly, it would be key to have the approval and endorsement not only of immunization stakeholders, but also health systems and PHC stakeholders in this process. Next slide, please. So in summary, we have seen that there are clear linkages between immunization and PHC within the National Immunization Strategies, and these synergies can be reinforced by using the Immunization for PHC framework for action. Ultimately, this integration of immunization and PHC can support countries in optimizing their health systems, delivering quality services, and promoting overall population health and well-being. I've provided here a few links, and we also have them in the chat for you to easily access to resources that might be useful for you and other stakeholders as you work on the development of national immunization strategies. Thank you so much for your attention. We are grateful for your time today and the critical role that you are playing in strengthening national immunization strategies. So I think we will now transition to an interactive segment of our program where we have prepared a few multiple choice poll questions for you. And this poll aims to gather insights about the development of national immunization strategies and the commitment to using the Immunization for PHC framework for action in your work. So I hope you can see the poll questions now. The first question we have here for you is, when is your country planning to develop its next national strategic document related to immunization, such as a national immunization strategy? And there are a few response options that if your country is currently developing your NIS or plan, your country is planning to develop the NIS or plan in the next 1 to 3 years, your country has already developed the national immunization strategy or plan in the previous 1 to 3 years, or you don't know. So please choose the option that best applies to your situation. And if your work is more at the global or regional level, recognizing not everyone here is a country colleague, please feel free to drop in the comments in the chat to see where you see the framework may be potentially useful in the work that you do, or where you see it may align to the work that you may have supported in relation to an NIS. Just looking at the comments coming in. The responses we have, it looks like about a third of countries have already developed their NIS. And then we have some responses following that they don't know, followed by countries planning in the next 1 to 3 years. Or currently planning, and then in the next 1 to 3 years. Great. Well, I think we will, in the interest of time, we will move on to our second question. What type of commitment can you make on how you will use the Immunization for PHC framework for action during immunization strategy and planning processes in your workplace? So moving on to that whole question. we have the following response options. I will download the framework from the website and review it. I will share and discuss this framework with my colleagues. I will consider how to incorporate PHC into my country's immunization strategies and plans. And please note that you can choose multiple options that apply to your work for this question. And we'll now give a bit of time for responses to come in.
Tova, I think we have all of our responses also for that second question.
Great. Are you able to see those responses? We have, again, yes. Majority have developed their NIS, followed by don't know, followed by developing in the next 1 to 3 years. Or current, so followed by currently, and the last is planning in the next 1 to 3 years. Moving on to our second question. We're asking that you make a commitment today because evidence shows that when you do make a commitment and write it down, you're more likely to do it. So we really encourage you to continue the conversation and share your experiences with immunization strategies and the framework in your workplace.
Tova, I've closed the polls and stopped sharing those results, but perhaps let's pass it to Dr. Lola to introduce our next two speakers.
Thank you so much. Over to you, Dr. Lola.
Thank you very much, Tova, for the overview you gave us. And Tova Tempet is a primary healthcare policy partnership advisor from WHO Special Program on Primary Healthcare. She's just provided us the overview of the IA 2020. The next two panelists, we have Dr. Adolphus Trocan-Clark, is a Liberia EPI manager, who will discuss Liberia's experience on integrating immunization and primary healthcare. Then finally, we would have Dr. Mohammed Ahmed Kazi, the Director General for Pakistan Federal Directorate for Immunization. He will discuss how immunization fits into Pakistan integrated primary healthcare strategy and how this has led to increased immunization coverage in Pakistan. We hope the presentation will give you ideas on how you can integrate primary healthcare into your upcoming national immunization strategy. So over to you, Dr. Clark from Liberia. Thank you.
Thank you. Let me say good morning, good afternoon, good evening to all, and thanks for the opportunity for being here at this point in time. The next slide, please. So firstly, I'd like to say that Liberia has transitioned from a comprehensive multi-year planning to now National Immunization Strategy. And within our NIS 2023-2027, we have a vision that states that we want to ensure equal access to efficacious life-saving vaccines for all of our targeted beneficiaries. And also our goal is to ensure that the population remains protected and prevented from vaccine-preventable diseases within the length of birth of Liberia. In the context of primary health care, we recognize that this is a glorious platform that could be leveraged upon not just to deliver immunization services, but to deliver other primary healthcare services such as vitamin A, macronutrients, deworming, the insecticides, treated bedness, etc. We also see this as an opportunity for collectivism, where we can expand access to essential health services to people beyond 5 and 10 kilometers that do not have access to health services. And we think this is a glorious opportunity, but that immunization services also be expanded. And also it helps in this opportunity to vaccination. Next slide, please. Next slide. So these are just the components that we'll talk to have like enhanced link with PHC and that of the National Immunization Strategy, ranging from strengthening health system to that of resource mobilization and national sustainability. Next slide. Next slide, please. So how is that linkage or linkages working? We'll recognize that there have been bi-directional investment into improving not just immunization services, but also primary healthcare facilities across the country. And those investments provide an opportunity for us to leverage on the primary healthcare workforce, the supply chain system, inclusive of immunization supply chain system, logistic opportunity, as well as infrastructure and other equipment at that level. Also affords us an opportunity to continuously mentor supervisors and supervisees that are providing district and health facility level, and then to improve upon our practices. Next slide, please. Now, we would like to flag the importance of coordination and collaboration. We'd like to see here that we have the highest level of political commitment from the Office of the President. From the angle of the sectorial context, we have what we call the Health Sector Coordination Committee, which serves as the largest body for health decision. And this is an opportunity that the sector discusses issues with respect to health, and immunization is deemed as a standing agenda item during said time. We also have a mechanism for partners that we call the Health Sector Coordination Mechanism. We also have a platform to discuss with NGO and civil society organizations that are working in health at county, district, health facility, and community levels. The next slide. Next slide, please. So we like to say in terms of health information, we are leveraging on the DHIS2 platform to receive immunization data from the lowest level to the central. We have in place a defined strategy of guideline with respect to increasing data use, and service providers have been trained, inclusive of vaccinator, on how to interpret and use data for decision making. The sector also has a mechanism for verifying information that we call verification of information. And we've developed quite recently a data quality improvement plan for 5 years to ensure that the quality of data coming from the lower level meets 3 basic standards: accuracy, completeness, and validity. More besides, we have now in place what we call an electronic immunization registry to be launched for data collection from the lowest level to the national level. And we have other integrated services taking place with data being integrated into the DHIS2. The next slide. That commitment and demand plays a very critical role, and we recognize the importance of the CHA platform. So we started to partner with the community health program to ensure that the CHAs and the CHPs are providing immunization services, as well as doing health education on immunization services, and also using their structure to address the issue of mis and disinformation as it relates to immunization services at the community level. The next slide. Next slide, please. For coverage and equity, we like to say that we're concluding an equity assessment that is supported by UNICEF to understand reasons for zero dose unvaccinated children in these communities, and coming up with strategy to improve immunization service delivery across the entire country. We are also providing peering and intensify outreaches to ensure that there is no child left behind because of where he or she lives within the territorial confines of Liberia. The next slide, please. So we'd like to say that our efforts to public health respond as much as possible has been flexible and adaptable based on the county context, and we've been involved in mobilizing resources. The government has been very supportive of increasing the immunization budget within the national budget framework from 50,000 in 2010 to $1 million now in 2022, and we look forward to increasing that more. More besides, we now have within the public health law section 10.7 that talks about immunization trust fund. We are in the process of establishing a new immunization trust fund to ensure that with time the government can stay on its feet as we prepare for possible transition, if need be, to domestic resources to fully fund immunization services. And then we try to strengthen our accountability mechanism at all levels to ensure that it is robust. Next one. So in summary, we just like to say that linking primary health care with national immunization strategy is critical to achieving optimal immunization coverage, reducing zero dose unvaccinated children. They also serve as an enabler for health system, strengthening coordination, commitment, and demand. And most of the lessons that we learn from that is that having strong political commitment is the best way to go in addressing issues of inequity, and having to have a flexible delivery strategy being developed, because we recognize that one size cannot fit all, and it sets the path for ensuring financial sustainability. Thank you.
Thank you very much, Dr. Dolphus, for providing us the Liberia experience. So we now go to Dr. Kazi to provide us with a Pakistan experience. Thank you very much.
I'm not sure if Dr. Kazi is with us. No, I think we might have lost him. Jessica?
Yes, Alex, would you like to go ahead and play the first part of the recording, and then hopefully he rejoins and he can take over live when he rejoins?
Okay, thank you. Give me a minute.
Thank you in the chat. And I wonder if for the first question, Tova, would you like to say anything about that? So Dr. Gayoor asks, does WHO know if we have examples of countries where immunization is not a part of their PHC delivery system? And Tova, if you have any insights on this question, on how this ties to the PHC levers, the PHC framework, that would be great. And as you answer, Tova, then I see that Dr. Kazi has come back on, but Tova, go ahead.
Thanks very much, Jessica, and thank you very much for this question. I think we have a range of experiences based on different contexts and health systems across the world, and in our framework for action, there are different examples of different contexts and development phases. And so I think that's a helpful place to look for countries that may not have as strong of a leadership or commitment towards primary healthcare. And then in looking at that, looking at ways to strengthen the PHC approach, looking at the different levers that have been outlined and the activities that we noted in the framework for action, and linked to specific actions that can be taken within the immunization space. So I think we have Dr. Kazi here, so I will stop now, but thank you so much for these questions.
Thank you very much, Ms. Tova. Good evening, Pakistan Standard Time, dear colleagues, distinguished participants. Today's webinar focus is on immunization for primary healthcare framework for action, building primary healthcare linkages within national immunization strategies, with the objective to understand the importance of integrating primary healthcare objectives into the national immunization strategies while citing the concrete example and experience to achieve better result. Next. My presentation outlines will inform you about international and national commitment for integrated primary healthcare strategies, achieving the universal health coverage status of Sustainable Development Goal in the country level, primary healthcare linkages with national immunization strategies at health, leadership, service delivery, and community levels, modalities of immunization within primary healthcare, impact on immunization indicators, plans to further enhance PHC linkages with immunization, and national EPI partnership support network. Next. Let me start with the commitments. As we all know, integrated primary healthcare strategies for achieving universal health coverage, which has been addressed in the global and the national level, such as Immunization Agenda 2030, a global strategy to leave no one behind. It reduces the mortality, morbidity from vaccine-preventable diseases for everyone throughout the life course, leave no one behind by increasing the equitable access and use of new and existing vaccines, ensure good health and well-being for everyone by strengthening immunization within primary healthcare and contributing to the universal health coverage and sustainable goal. The EPI vision incorporates international commitment like Immunization Agenda 2030 and others, as well as national direction and principles, thereby contributing SGD3 as mentioned in the National Health Visions 2016 to 2025 and National Emergency Action Plan for Polio Eradication Initiative. Therefore, I will say EPI national vision and goal is aligned with an international and national commitment and vision to achieve the universal immunization coverage, leaving no one behind to die from vaccine-preventable diseases. Next. This is data about the status of Sustainable Development Goal indicators at a Pakistan level, collected from Pakistan Demographic Health Survey 2017 to 18, Pakistan Social and Living Standards Measurement Survey, and some data from United Nations Interagency Group for Child Mortality Estimation 2020. Of course, this status is 2-3 years old, and somehow Pakistan did its survey recently where population increased to 240 million with annual growth rate of 2.5%, according to the recent census results. And hopefully all these surveys will be conducted and the results will be shared where we stand for Sustainable Development Goal. As we all know that universal health coverage is a part of Sustainable Development Goal adopted by United Nations in 2015, and Pakistan is a signatory of SGD. Let me talk about the National EPI program, which utilizes the network of around 9,000 EPI sites, approximately 15,000 vaccinators to immunize 7.2 million children under 2 years of age and 7.4 million pregnant women annually. The overall aim of EPI program is to contribute SGD3 goal through reduction in vaccine-preventable diseases for all nationals, while inoculating through routine immunization, through outbreak response campaigns, or all eligible population during pandemics and emergencies. Thank you. Next slide. This is an example of primary healthcare linkages with the National Immunization Strategies at health leadership level. As you know that governance and coordination has a key role in playing the immunization policy. Whenever EPI needs some change in its policy, such as in routine immunization schedule based on evidences, which will be technically reviewed and recommended by NITAC and endorsed by NICC. that is National Interagency Coordination Committee, chaired by Honorable Federal Minister of Health. Next. These are the few examples how PHC and immunization staff sit together right from the national level to the district level and provincial level, and how they interact in a way of frequency, like annual review meetings, quarterly review meetings, and monthly review meetings. Because by leading and chairing events, it says leadership, governance, and management, which create an environment for effective coordination, financial management, and performance monitoring at every level of immunization program within PHC model. Next, please. This is the PHC linkages within National Immunization Strategy at a service delivery level. And this is a process flow diagram of formal healthcare system, which is focused on an immunization. And if you see the criteria on the upper left corner of the slide, you see the information flow, which is from community to the district level and even higher level at a national, which is the national. So this indicates the information about monitoring and evaluation data, vaccine preventable surveillance data, vaccine coverage reports, and communication and advocacy. Then you see patient referral, which is gray arrow. This shows how serious patients are referred in a systematic way to higher and tertiary level health facilities based on availability of services and the needs of the patient. Then there is a material flow, which means VPD surveillance, which is very important and has sentinel sites also, the sample collection and sending to the national laboratory for testing purposes. So, certainly this shows that immunization coverage showed improvement after integration into the PHC initiative model, emphasize on achieving equity, addressing gender barriers at all levels, and reaching out to the marginalized, most vulnerable population subgroups. Next. This is another example at a community level. It has 8 community-based primary healthcare services, out of which immunization is a part and delivered in an integrated manner under child health. In Pakistan, the National Lady Health Workers Strategic Plan 2022-2028, focusing on primary health care for universal health coverage and resilient health system with expansion of lady health workers. In Pakistan, the lady health workers have significantly accomplished the reach of primary health services to communities. Otherwise, they were unserved or underserved by formal health system. Next. These are the modalities of immunization service within primary health care. We have 2 routine services, which is focusing on universal health coverage benefit package with the essential services in it. And nobody should be left out, and even person who have a financial hardship can receive the services. Then refurbishment of health facilities and solarization, not only to the EPI center, but it is as whole. Then integration of emergency services, where we have examples of COVID-19 vaccination, where Pakistan achieved fully immunization of eligible persons, over 90%. Then polio eradication initiative, reaching the unreached children in high-risk UCs in an integrated manner with other pluses. Then for disasters, floods, health camps in an integrated manner. Next. This is impact on immunization indicator due to the integration of PHC and immunization. If you see the bar chart, the number of zero dose Pakistan sustained and recovered, and it is data shows from 2019 to 2022, the zero dose percentage has dropped and reduced, whereas the penta coverage has improved. And then even during the COVID-19 pandemic, the period, these percentage were slightly dropped, but because of integration, Pakistan recovered. Then there is a bar chart of Penta 3 coverage percentages. These are the assessed coverages by the Pakistan Demographic Health Survey 2018 and third-party verification of Immunization Coverage Survey 2022. There is a marked increase in Penta 3 coverage. Next. This is a heat map, and from the MIS admin data coverage of Penta 3 and fully immunized children, which shows there is a remarkable improvement of Penta 3 and FIC children from 2019 to 2023. Next. These are our further plans, how to enhance PHC model with immunization, project with the Gavi food portfolio planning. Objectives are there. The National Health Support Program with the support of World Bank and Gavi. It has also its objective, and these are the ongoing activities and objectives are mentioned there. Next. Yes, the very important National EPI Partnership Support Network, because Pakistan believed that we cannot achieve the improvement without integration with the PHC, because over the years, Pakistan EPI program has been able to put emphasis on providing quality services. And further, we aim to achieve sustainable development goals through PHC framework action with unwavering support of partners and political commitment of the governments. Thank you very much.
Thank you very much, Dr. Kazi, Dr. Adolphus, and Tova. We now go to the question and answer session, and the key question goes to Liberia. They'd like to understand how you establish the Immunization Trust Fund. How did you establish it? Who are your partners? And who has contributed to the Immunization Trust nation financing coverage? At the same time, generally, we would also like to hear from the two panelists how you were able to garner support from the government to include immunization into the PHC activity. So please, can you all put on your camera so that you can give a brief on this, please? But most by Dr. Liberia, please, can you provide that answer?
Yeah, and thank you, Doctor. So let me start with the last question, which is general for the both of us, and then we'll pivot towards the direct question for me. So the history of government's commitment to own up immunization services through incremental budgetary support started as far back as 2010, when we began working with the Sabin Vaccine Institute that was working with countries on what we call sustainable immunization financing. As part of that support, we succeeded in establishing within the parliament what we refer to as the Parliamentary Forum for Immunization. That forum serves as an immunization advocacy mechanism to ensure that immunization gets the needed budgetary support as reflected within the national budget. They meet on a quarterly basis to discuss how the immunization program is performing and what are the challenges around accessing domestic resources. So that has helped in propelling us to experience a budgetary increase from 50,000 to 1 million as of the 2022 fiscal year. Now, with respect to the National Immunization Trust Fund, the first thing we recognize is that it is an open secret that donor resources are dwindling, they are going down by the day. And so countries should be able to brace herself for owning up its national immunization program. So the first thing we had to do was to establish a legal mechanism. And that legal mechanism was to have a relook at the National Public Health Law, what the law says. Chapter 10 of that law focuses on immunization. So we're deliberate and intentional to say that within that law, there should be a subsection focusing on the establishment of a trust fund. And we were able to identify commodities that could be levied taxes upon to ensure that the trust fund is supported. So it's a similar mechanism to the rule form where you have a specific percentage that is placed on petroleum products. So within that trust fund, we're able to identify commodities and other services to contribute towards the immunization trust fund. So for instance, we have a proposed percentage on alcohol, we have proposed percentage on tobacco, and we also have percentage on calls, GSM connectivity. People who are calling, what proportion of their payment towards calls are actually contributing towards the National Immunization Trust Fund. What is left is for His Excellency the President to constitute the board, and that now will move the entire process forward. So in the instance where we have an emergency because of limited or no donor resources, we can move into the trust fund to offset any immunization gap as may or may be determined based on the circumstances. Over.
Thank you very much. Two quick ones for Dr. Kazi. Somebody wants to know when you establish a national immunization strategy developed. Maybe you can quickly answer on the chat box. And then for still on Dr. Adolphus, they want to know the response of your health professional bodies. So maybe you could quickly just type the response for them because we are almost short of time. There's a question for you when you are discussing about the trust fund, that what was the response of the health professionals to the idea? Then for Dr. Kazi, when was the Pakistan National Immunization Strategy developed? So you can respond to that on the chat box quickly because it's almost time. Can you hear? Hello, Dr. Kazi? Hello?
Yes, thank you. I'm just writing down it.
Okay.
So if you want, should I write it or I should just say it here?
I think you could say it, yes, in space of time, please.
Yeah, Pakistan immunization strategy started way back in 1978, and where the few vaccines were introduced initially. And then time to time, Pakistan, because Pakistan has, as I said, this National Interagency Coordination Committee, which is chaired by Honorable Federal Minister, and the Donors Partner Coordination Forum for effective recourse mobilization, resource mobilization, exchange of information and technical expertise, review progress and approve new intervention and policy. So, you know, time to time, once we have developed a strategy in 1978, then it went under reviews. And finally, we have a technical body where National Immunization Technical Advisory Group, NITAG, which is chaired by renowned technical expert. Presently, it is being chaired by a president of Pakistan Pediatric Associations, and then in this NITAG, the Gynae and Ops Association, and various other, you know, the partners, donors, they also participate to give, and then researchers, and that guides policymaker for evidence-based immunization-related policy update and decision. So there are proper forums, and we update policy accordingly, as I said.
So thank you very much. And Dr. Adolphus, the last question goes to you. What was the response of your health professional bodies to your establishment of the trust fund?
So I responded in the chat, but I can restate. So I said that it was very productive or responsive. They saw this as a genuine approach towards financial sustainability, and they were behind us supporting us to ensure that this is moved into full effect. So they have been very supportive. Over.
Thank you very much. The last question, so I think we've come to the end, and I would like to thank all the panelists for sharing their experiences and to our wonderful audiences for sharing theirs as well. We have put up the link in the chat for the IA 2030 Immunization for PHC Framework of Action, and we hope you will look at it, share it with colleagues, and continue to build on it. You are all part of the movement to strengthen immunization programs as part of your program. I'd also like to remind you that the slides and recordings will be sent out to you. And it's been a wonderful day, and I really want to thank everybody for participating. Over. Thank you. Jessica, you have something to say?
No, I think you have covered it all, Dr. Lilla. Thank you so much who attend today, and all of our wonderful presenters. And you will receive the links and the webinar recording. Alex, over to you to close.
Thank you very much. So everything was said. We'll send you the links to the recording and the slides. The recording will be available in English and French, and you can share. You will be able to share widely. Thank you very much, everyone. It was a very insightful presentation. Does anyone want to say a final word? Dr. Falaki, anyone? No?
Just thank you all. Thank you.
Okay, thank you very much. So have a very nice rest of the day. For those who start the day in the US, have a very nice day. And for those in Pakistan and further east, have a very nice evening. Bye-bye.
Bye-bye. Thank you.
Thank you very much.